we are here to look at the recommendations of a study. And this is a global study.
We were privileged. Kenya was picked as the one of the pilot countries. Maoni yetu yenye tutasema hapa ni maoni ya all the informal settlements in Africa.
These recommendations are about health and gender.
We acknowledge that these settlements are a bit diverse.
The business of housing is much bigger than the four walls. Because we are saying for a house to be adequate, to be considered to be adequate, it must have certain things. One, it must have services. Then number two, for a house to be adequate, it must be affordable.
So I know it was a good choice to pick Kenya as a pilot country for Africa, and also Mukuru itself now when we come down to a specific informal settlement. We have so many issues when it comes to health-related challenges that are also affecting gender equity and gender also equality in the informal settlement. What are some of the health challenges affecting the residents of this informal settlement?
Inadequate water supply. Water tunajua inatumika hadi kwa hizo machoo. If the toilets lack water, zitafungwa. What people will do, they'll start using the flying toilets. The flying toilets itafanya magonjwa pia zinakuwa mingi, pia kwa watoto kwa sababu hizo mitaro zinakuwa blocked. Hiyo sewage kukinyesha itaingia kwa manyumba, so causing a lot of diseases in the community.
Our toilets are constructed very far from where we reside. Sometimes you find a toilet is around 50 meters a distance from the house. So you can imagine when they are closed, because the person who operates that toilet, they don't stay there. They have to close during the evening hours. Sometimes they have to close during weekends. Sometimes they even go for holidays.
So it becomes a challenge, especially for us who want to use the toilets at night and you cannot access them.
So another issue is inadequate health facilities, because our health facilities in Mukuru only works weekdays. So ikifika ni weekends hazifanyi job.
Kama huko kwetu unapata level 4 ndio iko at least conducive kwa wale wenye ni PWDs, na ile ingine si sana hawezi pita. Alafu pia hizo choo zao like si poa na PWDs. Kando na hiyo, sisi wanawake unaona tuna contact UTI haraka na zile choo zuendwa, tuko na less water huko. So unapata venye mika ni mwanamke nitaenda kwa hiyo choo, nitaenda tena nimeenda kutibiwa ugonjwa mwingine na rudi nyumbani na UTI.
And we also have issues on pollution because of the local industries. We have respiratory diseases for children and women.
Drainage zao wamelenga kwa hizi tuseme tu si lines zinapitia huku kwa kijiji. So unapata saa zile kumenyesha zina overflow. Unapata sasa wale tunaishi huko karibu huko chini, unapata maji ita overflow, itakuja ingie kwa nyumba.
We've also had challenge with the pollution in-house, because most of our community lack enough money to buy LPG gases maybe they can use in their houses.
So wanaopenda kutumia makaa ama kuni ama wanatumia stove. Na tunajua most of the time hizi types of fuels zina produce carbon dioxide. So zina causing health issues sana kwa mama na watoto, juu sana ndio wanapatikana jikoni.
Mimi nasema lack of dumping site. Unapata takataka zinatupwa kila mahali na watoto wadogo wanachezanga na kila kitu, so wanashikashika hadi hizo flying toilets, inaleta cholera na typhoids.
Our houses most are iron made and they are small, is 10 by 10. This house consists around 8 to 10 people, a family of 5 people.
Tunasemanga self confused kwa sababu kitchen iko hapa, bedroom iko hapa, sisi tunazitanga zote hivyo. Yaani ukiingia tu hivi kwa mlango unaona everything.
Women and girls wanakosa sanitary pads. Na bahati mzuri wakipata mahali watanunua moja, ina family wakiwa wanawake watatu, mama na wasichana wake wawili, hiyo moja wanagawana. Unaweza pata hata wengine anatumia moja kutoka asubuhi mpaka the following morning, and that affects women.
Cases of sexual violence na rise cases za domestic violence pia zinaongezeka, na hizo ni baadhi ya zile vitu ambazo zinafanyika hapo kwa community yetu.
So another challenge ni tunaweza sema ni drug abuse, because utapata mtaani saa hii kumechipuka mambo kama, kuna kitu sasa tunaita mrambe, vijana watu wamepotelea huko, hii pombe ya kienyeji wamepotelea huko, na pia kuna hii ingine bank na fegi.
Also another challenge we face in Mukuru, it's demolition. They are off and on, so even up to date you'll find there are people who are living in the tents, they don't have houses, so they are exposed to coldness. Another challenge we face is fire outbreak, which happen like a month cannot end when there is no fire outbreak, and most people affected in this fire, you will hear a child died, a woman died, because they are always in the house, unlike the men, then everything is destroyed.
We need the government and all other stakeholders to ensure that women and girls in Mukuru are secured. Kindly prioritize the issues of sexual reproductive health and menstrual hygiene. And so we would like the government to really ensure that there is enough supply of sanitary pads, not only in schools, but in all public institutions, even in churches, even in hospitals, even in community-based organizations where people and women can access such sanitary wear.
Introduce piped water systems, advocate for sanitation policies, prioritizing informal settlements, promote low-cost water filtration and treatment at the household or community level.
For a family matters awareness program, e.g. sexual education and information, love and lives.
Advocate for development of communal areas to elevate overcrowding in homes and support community-led initiatives for shared space. Provide emergency support services and relocation assistance for displaced families.
Run awareness campaign on indoors air pollution and fire safety practices. Raise awareness about hydration, cooling techniques and respiratory projects.
Improve street lighting along pathways to community infrastructure, into bracket water points, sanitation facilities, etc.
Introduce more PPDs and affordable and efficient supply of clean water.
When it comes to building, we can use materials that can resist fire. If my house is affected, the neighbor one is not affected.
So all those things require us to work together, because it's a development process that takes time, but we'll get there.